America's healthcare system is in crisis. One of the areas being hit the hardest is the Medicare system. Americans are living longer, and chronic disease is affecting the quality of life for both seniors and their caregivers. And things are likely to get worse as demand for healthcare services increases.
Prevention and self-management are going to be the two major trends in dealing with chronic disease management. And Medicare will be impacted by having to pay attention to prevention and paying for services they haven't paid before. It's a changing landscape. We're moving from the disease-oriented approach to prevention and chronic disease management and function-oriented as opposed to disease-oriented. And I think that's a major shift in the landscape of health and Medicare in particular.
Experts say that as more people live longer and older adults grow in numbers, the strained system has an uncertain future.
What we see is a very steady rise in the 65 and older, but what is really impacting healthcare is really the almost four-fold increase in 85 and older in the population from the 60s. And that means that we're going to deal with more individuals who have chronic diseases and some functional disability. And I think that will be the major impact on Medicare in the near future.
Solutions are available to help this growing population stay healthy and independent. People with Medicare living in Southern California have the option to choose an HMO plan designed to help chronically ill and frail patients get the care they need.
HMOs, health maintenance organizations, are designed to provide preventive services as well as acute services and emergent services, of course, across the continuum of a person's life. A frail individual who's suffering from a chronic disease needs access to all of those services that are available through doctors and hospitals and ancillary services. And that's, in essence, what an HMO provides.
Health plans like these help give seniors more control in managing their own health care so they can live as long as possible in their own homes.
Well, the seniors have generally chronic medical problem, and when they have a chronic medical problem, one of the key things is whatever we can do to keep them independent, or what they call as improving their function, and providing any extra benefits to the seniors so that they can stay home independently is, in my mind, a key issue.
Oh, SCAN has been there for us all the time. Every time we've needed them, they've been there right away and taken good care of us. They've supplied her with all her needs, so they sent her home from the hospital, have checked her out, and they've sent people to even exercise for her and taken good care of her. And we couldn't afford to pay this if we had to pay it on our own. It's a great plan.
For the past 30 years, SCAN Health Plan, a community-based nonprofit organization, has been focused on providing affordable health coverage for people with Medicare.
SCAN was founded by 12 frustrated seniors in Long Beach that couldn't get the services they needed to help them stay independent. Over the 30 years since, we've continued to fulfill that dream by helping people get the right health care at the right time while living independently. And we do that by providing them services to keep them living at home, as well as to provide the right health care.
One of SCAN's major goals is to help people on Medicare make informed choices about their health.
SCAN understands the issues of aging. Seniors progressing through the course of time can become fragile and then ultimately frail with chronic conditions. We educate them, we empower them, we encourage them, and we coach them in an understanding of their disease state and how best to manage it. At the same time, we work with their providers to share our geriatric expertise to add value to the doctor-patient relationship.
We have a great partnership with SCAN. I take care of a lot of elderly patients in my practice, and one of the needs of my elderly patients are we want to stay independent at home. And that's one of the benefits which SCAN provides. We provide a home care benefit which has been very, very helpful for my patients.
Finding innovative ways to help manage the chronic conditions of an aging population not only improves people's lives, but ultimately helps resolve some of the issues in our current Medicare system.
We partner with our providers in the network to make sure that we share best practices and at the same time afford access to the member for doctors and facilities near their home. the same time, we recognize that the seniors' world shrinks with time. So we find community resources near their home who can provide meals in the home, provide transportation to their caregivers, to provide caregiver support, and ultimately provide access to social and physical programs that will enhance the quality of their lives.
If you have Medicare, I recommend that you take SCAN. They've taken great care of me and my wife, and they will take good care of you too.